basically the logic is we implement actions, we need to see how we're progressing on these actions. We need to see how we're doing, basically, right? To refine them as needed, to successfully implement them. So the purpose and objective of health M&E would be then to assess progress and effectiveness of adaptation strategies in enhancing health resilience and sustainability amidst or in the face of climate change, right? So what this M&E does, of course, it tracks changes in health indicators now, right? Disease incidence, mortality rates, and specific vulnerabilities that have been identified also by Regan beforehand, right? So like any specific like indicator that helps us gauge the quality of our health system or gauge the vulnerabilities, the problems with our health system that we can use for an analysis and for targeted policy making. As for the main components for a monitoring and evaluation system, what we need would be, first of all, a well-structured plan. Right? Sounds very generic, but this is across all sectors, of course, with very clear objectives, standardized data collection protocols, community engagement strategies, making everybody's voices heard as much as possible, reporting mechanisms, and supported by institutional arrangements. We saw this in the first presentation, or in this second today of the first topic on the adaptation fundamentals. Institutional arrangements sounds like a blurry term, but the idea is, of course, that these arrangements are the fundament for every sort of analysis, data collection, monitoring, and so forth, because first, stakeholders need to know what is expected from them and how are they to collaborate. Then it continues, of course, with data collection methods, to be able to do baseline assessments, to evaluate these assessments and progress, and to reflect on challenges and lessons. So these are, let's say, building blocks of an M&E system. We saw some of those key health indicators, right? So I just mentioned a few of them: disease incidence and prevalence. These can be metrics such as the number of cases of climate-sensitive diseases, access to healthcare services, if possible, of course, disaggregated by segments of society, also by age groups, by gender, and so forth. The health system reliance, this taps into my example, for instance, like the energy supply for a hospital, the labor supply for a hospital, that the medical equipment is there, and so forth. So we can think of indicators, basically, that help us kind of find a metric, or that help us find a way to rate how resilient is our health system, or how is the access to the healthcare services, or how is the disease incidence, right? Or community and well-being as well, which enters more also the realm of qualitative research, of course, where we survey households, and we ask them how they're doing and where the issues are. So linked to the indicators that were presented this morning, right? SMART, so that they are specific, measurable, attainable, time-bound, and relevant. We have here two examples, right? Population health. So they need to be specific. Something could be, some specific indicator could be an incidence of diseases. Incidence right now of dengue fever, right? If that incidence increases, we know the corrective action has to also increase proportionally, right? Needs to be measurable. Cases per 10,000. I don't know the current number, but this is probably what healthcare professionals are right now doing in the country. Then ensure feasible data collection through health service and medical records. I hope that there's systems in place, and I believe there are. Otherwise, in the radio this morning, driving here, I wouldn't have heard about this, right? But these systems, they can, of course, always be improved. And they can be electronic, and there can be good ways to make this data flow very efficiently. There needs to be relevant, directly related to health sector goals. Of course, it's a health sector goal to reduce vector-borne diseases. And time-bound. So establish regular data collection intervals. We collect data on these kind of issues. It would be daily. But if we talk about data like healthcare, facility resilience, or how autonomous they are in their electricity supply, that's probably not something we would collect daily, maybe monthly, right? Implementing improvements there. On healthcare facility resilience, just about this example, we need to develop criteria for assessment to make this measurable. For instance, conduct regular inspections and maintenance to make this goal achievable. and establish as well these assessment schedules and prioritize actions. Another set of cross-sectoral indicators, because the health sector, as we already established, also because of your questions, is that is heavily intersecting with other sectors, right? The other group is upstairs. Health and water is very, very much interlinked for various reasons. So what we see here is, of course, the degree of implementation of mechanisms to ensure water quality protection, shoreline protection for saline intrusion, flooding, and so forth, percentage of households with improved water supply as a gauge as to how waterborne diseases may be affecting households, or water security, right? And implementation of early warning systems, which is relevant not only in the health, is relevant for infrastructure, transport, energy, agriculture, you can name it. So who's responsible? You. You and others. So in typical, when we talk about institutional arrangements for monitoring and evaluation on health, we have, of course, health ministries and agencies, so the state departments that have the national mandate, of course. Then we have healthcare providers and facilities that can be public, private, or a mix thereof. Research institutions and academia, and civil society organizations, community groups, and these need to work together, right? So we saw this graph before that showed sort of a, kind of a hierarchy of how these institutions are to work together. And this should be sector specific, right? I mean, in Trinidad and Tobago, there's an overarching system in the NTS when we talk about the specific indicators which were included in the National Adaptation Plan. But if we go even beyond that, there should be a smart way to ensure that the institutions across these, right, that are here identified, that across those that hold relevant data are addressed, and that they know where to place their data and in what format, in what units, so that responsible actors can use this data for enhanced decision making, of course. The objectives of an M&E roadmap to 2030, so what it should do. It should reflect the unique needs, of course, of Trinidad and Tobago. It should guide adaptation efforts within priority sectors, provide a framework for each sector to contribute to the overarching National Adaptation Plan goals, and serve as an instrument to monitor adaptation progress over time. So this is emblematic. This is, let's say, a way to sort of say like what an overall roadmap, an implementation roadmap should consider, right, for adaptation. In this national monitoring and evaluation system on health, so the National Transparency System of Trinidad and Tobago is, let's say, the system that centrally addresses climate change reporting and climate change related information gathering, right? So when we talk about health, then we talk about that data collection needs to include health surveillance systems, all right? So it needs to tap into health surveillance system and into leveraging existing health information, epidemiological studies, all right, and research that links climate, environment, and health, health impact assessments, community-based participatory research, and all of this is formalized, as already mentioned, in these components of the NTS, right? Who's responsible? How is the data collected? What is the overall objectives? How is it evaluated? What indicators do we have? How is it monitored? And how can challenges and lessons learned help us to refine this plan? I will enlarge this for you. So we have some indicators in the National Adaptation Plan that are specific to health. If you read the first one, it would be the number of projects undertaken on hazard mapping and climate risk assessment in the health sector. So we saw in the first presentation that indicators can be qualitative or quantitative. Here we see number of, so that would be quantitative, right? So how is this relevant? How is this indicator relevant to tracking progress, let's say, in enhancing resilience in our health sector in the country? Well, it is because by increasing the number of studies on hazard mapping, climate risk assessment, we get a better picture of where specific vulnerabilities lie and where we should prioritize our action, right? So this is a preparatory sort of adaptation measure that is tracked by this indicator that says, okay, let's see how many studies we have. It can be imperfect, it can be 100 useless studies. Optimally, it would not be the case, and optimally, it would help us gauge the progress that we have towards establishing a more resilient health system. Just to speak about one more, that was the example shown by Regan before. The investment, so we saw the upgrades of the drainage infrastructure, right, as linked to water security, water quality, and vector-borne diseases, right? Like they're linked also to issues with the water system. So a good gauge for this, it would not be the number of drainage infrastructure projects, maybe, because it's a bit away from maybe gauging how effective it is or how well it is implemented. But better would be investment. So the overall number of US dollars or Trinidad and Tobago dollars that are invested into updating its drainage infrastructure. We might have a target, of course, the target being 10 million. And by continuously tracking the amount that is being spent on the upgrading process, we hope that the upgrading goes well and that the money is not lost in the process, of course. We would have a gauge as to how much is already of the project is implemented. So we could infer that our resilience right now is improving because of this, because our drainage infrastructure is updated. So what I'm trying to say with these examples is that we use specific indicators because there's a range of actions that can be implemented and they are being implemented on a daily basis. But when we have a plan like this, a NAP, National Adaptation Plan, we try to focus on where the most pressing issues lie. We try to devise specific adaptation actions that address these issues, and then we need a way to track them. We need a way to track progress on these actions to see where we might have to correct or where we see, okay, we're actually making progress, so we're augmenting our resilience in that specific aspect. So we can maybe focus on the next one. That is second priority. So this is the idea basically of a monitoring evaluation system. Also, as the name gives away, when we talk about adaptation in a specific sector, right? And that brings me almost then. So here we have this issue that this is with animations, and they don't work right now because the screen is shared in a different way. So we have this example, again, that we have the investment on upgrades of drainage infrastructure. So this is a typical indicator reference sheet that was developed under the CBIT project, right? So for the specific actions in the National Adaptation Plan related to health, what was done is that indicator sheets were developed that define a range of information and methodologies of how to track the specific target, right? So we have the indicator name, we have the sector that we have established. We established the adaptation relevance, contributes to strength and resilience to drainage to extreme weather events such as floodings, reduces vulnerability to vector-borne diseases, and so forth, and pollutants. It's a quantitative indicator because it's the dollar amount basically that is flowing into this. Is the measure gender responsive? No, in this case it is not. Optimally it is, and it was made gender responsive wherever that is possible. However, for a dollar amount in drainage infrastructure, it's very much related to infrastructure spending. It is not gender responsive, directly at least not, the indicator. Then we have data requirements. So how do we basically get a better grip on this, right? So number of drainage construction projects per municipal corporations, renovation projects per municipal corporations or local governments. So by compiling a list of all these projects, we have the costs associated. We can ask them for the costs, we can sum that, and we have a number that we can attach to that. We can say, okay, now it's 5 million. In 2 years, now we have 7 million, so we're progressing. Let's see if we're progressing enough. Maybe we need to correct. Data sources, those were developed or were placed there in consultation, of course, with the stakeholders, such as yourselves. The list can be longer. These are then some stakeholders that might have data on the projects that are being implemented and might have the attached dollar amount, of course. Then the process of data collection is that via the ministry, these sort of municipal corporations and contractors and governments are basically addressed and asked for this data. So this is as well specified. How often the data is collected, well, in this case, annually. Then we also do have some formula and some variables to sort of like, the number of projects and then the dollar amount attached to it, to have a gauge of how well we're doing. And as well, some reporting procedures, verification procedures, which is very much linked then to the M&E system, right? So to the NTS, because we talk about, right now we talk about what is good for the country, of course. Now we have this national adaptation plan. On a second level, let's say, these national adaptation plans are uploaded to the UNFCCC website, and countries are also asked to report periodically, every 2 years, on progress on their adaptation actions. Similarly to mitigation. So these indicators are also, of course, used for reporting. So the Trinidad and Tobago as a country can transparently show to the international community, similarly to all other countries that are also having these plans, they would periodically report as well on progress. And by that, globally, we have increased transparency, and we can see, okay, this country has these priorities, devises these actions, and tracks these actions, and is going in that direction. And if we link that, for instance, to the issue of climate finance, right? If we transparently show every 2 years in these reports that we show we have the national adaptation plan corresponding to our specific issues, and we're doing well on these 2 indicators, but not well on these other 2 indicators. The international community sees that, right? So we can also reach out and we can say, hey, we really want to get a grip on the drainage infrastructure. Is there maybe a chance that we can get additional funding? Also, companies that have access to these reports, they can see that, they can say, okay, there seems to be that this country is improving the drainage infrastructure. Maybe there's a chance to chip in. So there's multiple ways, of course, how transparency can help countries to address climate change further down the line. And these indicator sheets then sort of conclude with the lead institutions, reporting procedures, verification, archiving procedures, which is sort of like the indicator management. It's more of a procedural thing to just ensure that these indicators are correctly stored and correctly updated as need be. So that would then almost conclude the session. Let's see. The last slide, what it shows is the specific ref code. This is a reference code from the National Adaptation Plan. These are just the measures that were included, right? Hazard mapping, we talked about this. Then development implementation of climate change preparedness planning, undertaken interagency and utilities climate change risk assessment, focuses on health service delivery, the drainage infrastructure, the famous one, and improving climate change risk management within health service delivery, including built-in redundancies. They were also mentioned beforehand. And they have been subsumed in these 3 indicators. So these 5 actions are tracked by these 3 indicators. And we see that some of them have been grouped together, right? So the drainage infrastructure stays on its own. It's a very specific project. But we have others. So preparedness and response capacity to climate emergencies combines 5 and 2, climate change preparedness and risk management. And they have a common indicator, which is the degree, that's qualitative, of how prepared basically the climate and emergency health services are. And we have a number of projects undertaken on hazard mapping that relates to the first action and to the third, which is also linked to the risk assessment. So this is why the indicator reads as number of projects undertaken on hazard mapping and climate risk assessments, as these are very much linked. So this sort of showed the process of how first an assessment is done on the health sector, an adaptation plan is done, identifying actions, and then how these indicators were developed to just make it more feasible to actually track progress on this plan and to make it for policymakers. Like here, we have only 5 actions. In the energy sector, it's maybe 150. So this is why there's specific then indicators that combine these. And here you see an example for the health sector. So that would conclude the second part of the presentation.